Hi, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. I'm going to do a bit of a part two of the one that I did a couple days ago, the AAO white paper on SDB, the Mike DeLuke presentation, which was amazing. Definitely check that one out. You should see it. It would have published yesterday, which was May 20th. So depending on when these show up in YouTube, we might be a little out of order. But definitely, I would like you to listen to that video first before you listen to this, because this is going to be a part two on that one. Okay, so hit pause, go listen to the other one. If you're coming back, I'm assuming you've already listened to that video, the one that published on May 20th. It has like a picture of a podcast, and I will tell you the name of it. Give me 1 second. Let me find it while I'm looking around. But in any case, I wanted to tell you something that I did in response to that is that I decided that I was no longer a member of AAO anymore. And I decided that I was going to join the WFO instead, the World Federation of Orthodontists, because I need to get my CE from somewhere, and I need to go somewhere and get like ortho CE, and I'm over AAO. I'm over it, like over it. So I needed something else. And I needed a place to go to learn my airway, and I refuse to pay for some of these private for-profit companies for airway stuff because, to be honest, they know less than I do. I need to be with people who know more. So, all right, especially these for-profit ones that are just, no. All right, so let's talk a little bit about what I did. So I joined the WFO, the World Federation of Orthodontists. It literally cost me, you can see, $230 for 5 years, and it gives me access to all the courses, all the literature. I don't, it seems like it's giving me just exactly, if not more, than what AAO has. All the handouts, everything. I don't get my insurance through AAO anymore, so why am I with AAO? Nor do I go to the AAO meetings, so why? I don't need to. I don't need to hang out with my alumni people. No, thank you. So yeah, I'm happy about that. That just saved me a ton of money and made me happy. So let's talk a little bit about what the WFO is and how it compares and contrasts to the AAO in terms of core values. Especially airway is the one I wanted to get into. So yeah, there's a lot of international people that join AAO, but there's also a lot of Americans who can join WFO. So um, I'm going to, because I didn't know anything about WFO. I didn't even know it existed till a few days ago, and I didn't even know I could do this. So I'm letting you guys know you could do this, and it's way cheaper. But in any case, that being said, you got to keep in mind that this is a tough call. What we're doing here, we're transferring over to a different educational program is the standard of care. So I'm gonna go scope it out. But so far, I'm extraordinarily impressed with it. So listen, I didn't know anything about WFO. I do know what AAO stands for. I needed to compare and contrast because if I'm going to join an organization, I want to make sure it's what I represents what I believe in. So there's just no way. I mean, I don't trust Reddit for answers and X or anything. That's just people's opinions. So I turned to a variety of different AI programs to scrape the internet and to ask that question, and I got my answer. So I'm going to tell you what Gemini and Chat and Grok are saying. It's a combination of stuff. And to be honest, if multiple AI programs are saying the same thing, then that's probably what people are thinking. Either how it is or what people are thinking. But if it's what people are thinking, that is how it is. So as I always, anytime I make content that might be a little spicy, I tell people, look, if I'm saying something spicy about you that's not true, I will pull it down. I'm not even going to fact check it. I'll just pull it down if you don't want it up. I think for WFO, this is great. You're going to have so many people sign up, and I don't think people are canceling their AAO to join WFO. So I think if anything, it's going to bring a ton of people to the website to be putting this up here and learn more about it. And to be honest, if the only reason people are transferring from AAO to WFO is because they don't like their position on airway, so change your position then. It's that simple. And maybe change other things too. But okay, so let's talk about this a little bit. So this is what Chat says. So basically, the first thing they say is the slogan for WFO is beyond straight teeth. And then digging into what the slogan means, they say orthodontics move more than teeth. The campaign emphasizes that proper jaw alignment directly supports the airway, guides facial growth, and influences how a patient breathes. And by focusing on chewing, breathing, and speech, the WFO is addressing not only the oral functional and oral facial system, meaning how the muscles of tongue, mouth, and jaws work together for daily survival, aesthetics, and long-term health. That is the orthodontist I am. I am a dental facial orthopedist first, and I move teeth second. That's exactly how I am. So that made me like super happy. I was like, yay, when I saw that. Let me dig more into it. So let me dig a little bit more into it. So Now let's talk about specifically airway focused orthodontists and the two positions. So it says AAO takes a strict, this is rough, legally defensive, deeply evidence based stance following its updated AAO white paper on sleep disordered breathing, which I told you guys to listen to, the May 20th published. Or go straight to Mike DeLuke's podcast. I don't know what day. I think it was like last Thursday. I think it was a week ago. So you can do the math. Today's the 21st. So that would have been, maybe it came out on the 14th. I think that was the day it came out. May 14th. I think it was episode 156 on the Doc podcast. Go listen to that. I'll send you to his podcast anytime. It was great. So what they're saying is the AAO's position is screening is mandated, not diagnosing. That means the AAO states that orthodontists must screen for signs of OSA, but they cannot diagnose it. Diagnosis is strictly done by physicians. Okay, well, whatever. They also say AAO says expansion is not scientifically proved to help airway, and that it shouldn't be done unless there is a dental reason to do it, tooth reason. So you can't do it for airway, you have to do it for teeth. So if you don't, and I've had patients where massive airway issues, but there's no crowding. They don't, and there's no vaulted palate. They don't need expansion. Well, then we can't do it. Imaging limits. The AAO warns that 3D CBCTs have no diagnostic value for assessing sleep apnea or SDB. Nice. I mean, they're not kind of wrong. They said, well, because when you're sleeping, that's a vertical thing. Well, but then come up with something that does, because that's the closest thing we have that most people have in their office, and it gives us some data. It might not be able to fully, you can't say this causes this. If you have this, you have this, but it can be part of the process of diagnosing. If you have this and 30 other things, well, then you probably have it, right? Okay, versus the WFO's position. The WFO does not issue restrictive clinical mandates. It views airway orthodontics through an educational and global research lens, okay? So basically, they're just saying that you should go with whatever the rules are in that country. They're not getting involved. So they teach it. They teach all kind of stuff. So they focus on the mechanics of MSEs and RPEs and everything like that. So I thought that was super helpful. Okay. And regarding interceptive orthodontics, let's do one more comparison and then we're done. It says regarding phase 1 treatment, AAO believes in the 7-up rule, which I knew that. Every child should see an orthodontist by age 7. But when we say by age 7, that means by the time people get them in, it's 10. Because people aren't thinking 6. By 7 means 6. Yeah, by 7 means you have to go in before you turn 7, which means 6. So they said that's super important to do this, which I agree. So that, I mean, it is important, but they said it's only important for crossbite correction, thumb-supping habits, and guiding impacting teeth. So they just gave 3 reasons it's important. There's a lot more reasons it's important than that. Whereas the WFO says that it's really important to learn about it. It's really important to focus on skeletal development and to really look at this as an all-encompassing health issue. So anyways, I'm really excited about checking out the courses that WFO has. Any of you guys are also joining them, let's chat and maybe we can find some courses to go to. All right, thanks so much.